Ask the Expert, brought to you by CommonSpirit Health.
We are asking the expert with CommonSpirit's Holy Cross Hospital here in the Cardiology Department. I am talking with Dr. Richard Gelb. He's an interventional cardiologist. Thank you for chatting with me.
My pleasure.
Appreciate you so much. Okay, let's talk about cath labs, doctor. What are they and what procedures do you do in a cath lab?
So the cardiac catheterization lab is a radiological suite, and the primary procedure done there is coronary angiography and occasionally stenting or intervention. But it also is a place where we do a lot of other things. We measure cardiac pressures, cardiac outputs, right heart pressures, and it's basically an all-in-one diagnostic suite for diagnosing and treating different forms of heart disease.
Okay, makes sense. And I understand that CommonSpirit's Utah hospitals are equipped with state-of-the-art cath labs. How are you seeing technology in this arena advance so much?
Well, the cath lab technology has advanced a lot since I started in cardiology about 30 years ago. We now have a wide variety of stents, wires, and other equipment that allow us to get optimal results in the cath lab,
sure.
And often letting patients avoid having bypass surgery. And we think that the technology is continuing to evolve and get better.
Sure, and when you hear open heart surgery, and now you can go through a vein, is that more common now that you're seeing that instead of having to do open heart surgery?
Many patients can avoid open heart surgery with the new equipment that we have, and can often accomplish multi-vessel stenting with excellent results.
Which, if you can't avoid that, much easier recovery, right?
Yes,
much
for sure.
easier. Okay, when is a stent done versus a bypass surgery?
So there's a lot of factors in play for whether you need bypass surgery or a stent. One of the factors is your anatomy. So if you have really wide diffuse coronary artery disease or left main coronary disease, bypass surgery is usually the better option. Also, if you're a diabetic, they tend to do better with bypass versus stenting. But in patients who have more limited or more focal disease, and especially in non-diabetic patients, stenting is often the preferred primary therapy.
Okay. And with cath procedures, do they work long-term, or most people end up needing surgery, like eventually?
No, not always. I think that people who have stents who then go on to take care of their metabolic health, control their cholesterol, their diabetes, and hypertension, often don't need further intervention. I think that progression of coronary disease is somewhat unpredictable, but among people who really take care of themselves, it occurs much more slowly, and sometimes stenting is the final and necessary procedure, and patients can live very long lives after that procedure.
Oh, that's good to know. Okay, you mentioned taking care of ourselves. What are some things that we can do to take care of our heart health?
There's some very obvious ones. The modifiable risk factors for heart disease include high blood pressure, cholesterol, diabetes, smoking, weight, exercise. And so I think that paying attention to those risk factors is the first thing. I think treating these conditions is actually very easy once you pay attention to making the diagnosis.
Sure. Well, thank you for all this information. This is an absolute Asking the Expert segment. This is an expert himself. We appreciate you paying attention to our heart health and all the advancements in the technology. Thank you so much. And if you want more information, you can go to the website on your screen. Dr. Gelb, thank you so much. Great to see you.